Unfortunately, even in UK, it seems that the role of a midwife is kind of being pushed aside a little bit, and the whole thing is getting more and more medicalized.
Well, it sounds very similar. Unfortunately, back in my home country, Romania, home births are actually illegal.
Mm,
So, right. Hi, Barbara. Good morning. Thank you so much for accepting the invite today for a podcast. I just want to find out a little bit more about yourself, about some of your professional background, some of the advice that you would be giving to women. As you know, I try to support pregnant women throughout pregnancy and obviously birth so that they have the best experience that they can throughout this journey. So I'm really curious to find out more from yourself around all of this and what you can share with us. So thank you so much again for taking the time and joining me this morning. I'm sure you'll be a really interesting conversation. I'm convinced anyway, and I hope whoever listens to this will also find it as an interesting conversation, as I'm sure I will. So I will just go right in if that's okay. I'll just start asking you a few
sure.
questions. Thank you so much. So can you tell us a little bit more about yourself and how did you start this journey, your professional journey, and how did you get to where you are?
Hi, Emma. Thank you for having me. It's really a pleasure to be here and chatting to you. So, yeah, my name is Barbara. I come from the Czech Republic, but I've been living in UK since 2009. And I am a midwife and infant feeding specialist and a homeopath. My journey started about 20 years ago. Journey into midwifery and holistic health and stuff. When that was actually a little bit longer than that. When I was expecting my first daughter, who is turning 23 this year. Um, so yeah, as it is, before that I was a nurse, ITU nurse, all that adrenaline. I worked in a neurosurgical department, so we had lots of really difficult um, cases, and yeah, it was very interesting, very high pace environment, lots of technical stuff and things. But then, as it is, you become pregnant and your whole world kind of changes, and you
Absolutely.
start you start exploring other things. So I started learning about. Well, first of all, I was attending this antenatal course with this amazing midwife back home, and she introduced us to lots of like herbs and essential oils and things like that, so that we make the pregnancy as easy and as comfortable for us as possible. So I started exploring these things, reading a little bit more into it, and I really loved it. And I thought, this is so great. I really want to do something like this. So I then decided to study midwifery. So in my country, you have to do again 3 years from the beginning, regardless, not like in UK where you do just like 18 months course if you're a nurse to become a midwife. So I went back to university from the beginning, which wasn't that easy with a little one. Um, and here when people study university, a lot of them have kids and family and things like that. But back home, it's not. Or at least then it wasn't that common. So I was the only one who was
Oh,
married with a child. I was the eldest also because, again, at least back then, it's a little bit different now, 20 years on. But back then, you would do the route from A to Z. So you would go primary school, college, university, work, right?
yeah, yeah.
You wouldn't really go back to university years later to retrain, do something else. That's not how kind of it works back home. So I was a bit of a rarity,
Pretty
but it
much.
was really great. I really enjoyed it, and having that nursing background was really, really great. And yeah, that's how my midwifery journey started, and also the journey into holistic health, because not only I learned about the herbs and also homeopathy throughout the antenatal classes, but also our pediatrician then was also a homeopath. So when we had any issues with the kids, she would always ask, do you want homeopathy or do you want regular tablets? So I would always go for homeopathy. So she would prescribe what to take. So that was the beginning of my journey. And as I learned and explored all these things, obviously I used them for the other kids and for myself, for my husband. And we slowly kind of moved away from conventional medicines to herbs and teas and homeopathy and essential oils and all that. And then once we came to UK, carried on with this. And, sometimes when you're interested in these things, you start meeting people who are also interested in these things and it kind of comes to you. So slowly, I did lots of courses on herbs and I studied aromatherapy with Niels Yard and things like that. And I ended up studying homeopathy as well. So yeah, it just over the years, it just comes.
Really interesting. So when you came to the UK, were you annually qualified as midwife?
I was
Or did you have some experience
few
there?
years after school, but I haven't worked as a midwife in a hospital back home. I worked as an independent midwife. Bit long story, but basically they didn't want me in a hospital as a midwife because they knew that I support home birth and kind of alternative ways, which
Wow.
wasn't something that would be promoted. So yeah, the situation back home is a bit different. It's getting better, but back then definitely home birth wasn't something, well, it's still not something that would be welcomed. It's more or less prohibited. And yeah, so the establishment is pretty much about having the baby in the hospital and there is no other way. And if you are a little bit different or support a bit of a different way, then you are kind of the black sheep. So yeah, I had my second daughter while I was studying midwifery and I had her at home. And obviously the teachers, because my country is small, the cities are small, much smaller than the UK. So kind of everybody knows everybody. So the doctors who taught us um, in the university on the midwifery course were the same doctors who were working in the maternity hospitals in my city. We only have 3 maternity units in my city, right? So they knew all of us. So when we then went to practice, they knew us, we knew them, right? So obviously they knew that I had my baby at home and all that. So the boss of the maternity unit where I wanted to work basically didn't want me there.
Wow.
So so I kept working as a nurse. That time I worked in hemato-oncology, intensive care. So, people with leukemia and stuff like that, bone marrow transplant. Very
Yes.
interesting, but kind of the other side of the
Yeah.
other end of the life. Um, and I did midwifery independently. So lots of home births because there was and there still is that desire among women to have a baby at home, have the choices open, have other options than just the one. Um, and yeah, so it was really, really nice. So yeah, but that was also one of the reasons why we decided to move to UK so that I can work as a midwife in the way midwives are supposed to work. Obviously, the situation in maternity services in midwifery was slightly different 20 years ago than it's now, but still midwives here have much more autonomy. Home birth is still a normal thing. It's not something that would put you, outside of normality or
Yeah.
something. It's yeah, so it's much more open to options and alternatives and being more flexible. And as a midwife, you can still work in that sort of autonomous way kind of thing, and not as more or less obstetric nurse and as in many other countries.
Absolutely, yeah.
There have
Well,
been
it sounds very
situations
similar.
where people,
Unfortunately, back in my
given the
home country,
situation, ended up
Romania,
in prison, going to prison
home
because
births are
they've
actually illegal.
assisted a home birth
So,
or, supported
Yeah,
that mum
to birth at home. So regardless of the you get in trouble because there's just not
yeah,
supported by,
yeah,
well,
yeah.
it just leads to a very medicalized system then, and I don't know if that's the case in your country as well, but it becomes a lot more doctor-led, and the trust in midwives, it's really not there, and probably the role in itself is not particularly understood because people almost see midwives as, that profession that kind of does a bit a bit extravagant things, or a little bit out of the norm, is not medicalized and is promoting normal births, and so people think it's like, oh, maybe not what the normal medicine now is promoting, which it's interesting to hear you talk about this as well, because I think it's a lot of misunderstanding of the role of the midwife. So I wanted to
Yeah.
ask then, from your point of view, what do you think the role of the midwife is in this country?
Right. um, I think even in this country, there is a bit of a variation between what the role of midwives is supposed to be and what it actually is. So the role of a midwife is supposed to be supporting women in physiological pregnancy and birth, promoting the health, making sure that they're healthy, that their baby is developing fine, that they are having natural birth as much as possible. And obviously also detecting if things are not going quite to plan, and then referring the women to the doctor or to appropriate service to get more support. So, however, unfortunately, even in UK, it seems that the role of a midwife is kind of being pushed aside a little bit, and the whole thing is getting more and more medicalized, which there are many factors. Obviously, the population as such is getting a little bit sicker than we were how many years ago. It's much more complex. The demographics are very complex as well. The conditions that women have are getting more complex, and it's not just a flu or something. It's much more complicated conditions that can be quite challenging and need a lot of medical input. So it's a bit challenging to say what is actually a role of midwife these days. It's very dynamic, and I feel that things are changing even in this country, even though midwives still have that autonomy and we can still do a lot, we can still support women, but because the whole, let's say, the whole structure is changing a little bit, the whole
I suppose the
logistics,
complexity, yeah, and
the
the complexity.
complexity. Yeah. So I'm in London, and London is very busy place. Lot of we've got lots of people who just come and go. Things are very fast paced, and there's a lot of people here, so the maternity units here are very busy. Lots of births, and you can see in pretty much all units that the health of the women is not getting better.
Yeah.
It's getting worse. So whereas, and it's really interesting to see because in just that short time I've been in NHS since 2009 till now, which is just about 15 years, right?
Yeah.
16 this year. It changed so much, in
True.
terms of So I worked mainly in birth centers and within home birth teams, community midwifery. So even the amount of really low risk women who would be kind of predestined to access these services like home birth and birth center are much less these days than they were then, right? To
Yeah.
find a really low risk woman that would not have any issues is kind of getting difficult, right?
Yeah. Yeah.
And I don't know why is that. Is it because the environment we live in? Is it because of the food we eat? Is it because of the lifestyle we have, that we are constantly sitting in offices on public transport? We're not moving, we're not going out, you know. Is it the age of the pregnant women? Because, you know, women are starting to think about family and planning babies much later in life than they used to. You know, and all sorts of stuff that is in play, that the women are more ill. There is much more infertility issues as well. So all the IVF and things that can carry certain risks with it as well. So yeah, that also means that the guidelines are changing slightly to enable more women to access these originally low-risk services. So they're being now opened to women with certain conditions that are manageable in birth centers or even at home. But, you know, the whole sort of ethos or environment is kind of changing. So it's really interesting to see also in terms of where midwives' role is going, because also midwives are getting, which is actually not necessarily a bad thing, midwives are getting more and more roles and tasks that they can do within their role so that they can support the women better, right? So obviously in hospitals we also have many more midwives than doctors, so then that we can have one-to-one care from the midwife. Doctors cannot do it because, you know, the doctor is there one for the whole ward or something, right? So that's where the midwife is, like, to be with that woman, to support her through whatever she's going through, even if it's, let's say, a low risk pregnancy or birth, and only if, you know, the remit of the midwife's role kind of doesn't reach wherever it needs to reach, or if things get beyond certain point, then the midwife refers to the doctor. But even the role of the midwife is getting more and more technical, with more and more responsibilities that weren't there 15, 20, 40, how many years ago. So yeah, also the technology is different. We have much more technology, how we can, you know, monitor pregnancy, monitor birth, and all that plays a role.
Yeah, absolutely.
So yeah.
Absolutely. And as you're mentioning, there's lots of specialist midwives on the different areas. So I was wondering, I know you're a breastfeeding consultant as well as a tongue tie specialist. How did that happen? What motivated you to do that? And how long did the course take as well? I'm quite curious.
Right. So I first became lactation consultant, and I did that first back home when I had my second daughter. So I did like a training with Lale Chelik to become like a breastfeeding champion or whatever that's called these days. Just because I was interested in breastfeeding, and also back then it was still quite a norm that women would breastfeed, at least back home. It was like most women would breastfeed, and it wouldn't be like something we would even think about. You would give bottles and formula only if you really, really had to, if there was like some issues or, you know, things went poorly. But I just thought, because I really enjoyed my breastfeeding journey, so I just thought I want to learn more and maybe help women a little bit extra, because to be fair, midwifery training, regardless where you are, doesn't give you much information, much tools on supporting breastfeeding. It's about, yes, breast is best, and there are these common concerns, and you can do this, but it's not very practical, and it's very limited how much information you get. So I just felt, especially because I knew that I'm going to be working as independent midwife, I just wanted to have that extra knowledge, more tools in my toolkit to support these women. So I did that. And then when I came to UK, that was a bit of a culture shock in this respect, because I realized that women are not breastfeeding as much as where I come from. So I started looking into it and started talking to women and supporting them. And I realized that it's because there is not much support out there for these women, right? And the minute something doesn't go quite as planned or as easily as expected, women reach out for bottles. It was always recommended, buy bottles, buy formula to have a backup, bring it to hospital with you so that you have backup. That's unheard of in my country. You would not buy these things unless you really need it. And I was thinking, why do women do it, especially in like London, where you can buy anything anytime pretty much, right? You can decide in the middle of the night that you need a formula, and you go to your nearest petrol station pretty much and get some formula, right?
Yeah.
So or Tesco Express that is open 24/7. So it's not a difficult thing that you would need to have it at home, just in case, right? So and if you work in midwifery and you work with these women, and especially if you work like in terms of a home birth setting where you are seeing the women after the birth, or community midwifery where you're seeing the postnatal women, you need to know a bit more about breastfeeding and supporting that. So so that's how I learned. I kept learning more and more, and then I did a 1-year course with Indira Lopez Bassols here in London to prepare for the IBCLC exam. And then I did the exam. That was a really good course. I mean, for breastfeeding, to become a breastfeeding counselor or consultant or whatever the different roles are called, there are many different courses you can do, from the simplest ones done by UNICEF that most maternity units provide for their midwives. That is like a 2-day course, and then you have 1-day updates every year, to a year-long course just on breastfeeding. And that was a really great course that gave me a lot of information, lots of practical tools as well. And I did that exam and all that. So yeah, and when you're working with moms who have issues with breastfeeding and stuff, you inevitably come across tongue ties. And again, there is lots of misconception, lots of myths, lots of misinformation around tongue ties and what it actually is, how you diagnose it and all that. And even though I had that 1-year-long lactation consultant kind of course, we did learn about tongue ties, but again, it didn't have that practical element. So we learned a lot about the science and what it is and the anatomy and how it's treated and stuff, but it didn't have that practical element. And I started noticing that a lot of the mums and babies I help still keep having problems, and we can't get to the bottom of it. And I wasn't 100% sure whether that baby does have tongue tie, doesn't have tongue tie, or what it means. So I decided to look into it more and learn more. And I came across the work of Carmel Gentle. She is also a midwife by background, and she is a tongue tie specialist here in London. She's got a clinic in South London, and she basically works holistically with a tongue tie, not just yes, tongue tie, snip, bye bye. It's about working with the whole baby, with the whole mouth, the functioning, and helping them kind of optimize the function pre-division and post-division, and also looking at the whole body, whether there might be impact from pregnancy, from birth, some traumatic birth, forceps, or even like a C-section or something that can affect the body structures, and the baby might have tensions in their neck or anywhere else in the body that then impact how they feed, and it might then be misinterpreted as a tongue tie while they actually don't need any snips, things like that. So I really liked that approach. So, if you do like tongue tie training with NHS, it's a quite short course. But with Carmel, I did pretty much another 1-year course. So the way she structured it was that we did first about 3 to 6 months about just the assessment, just assessing whether the baby has tongue tie or doesn't have tongue tie, and whether this is type of tongue tie that would need the division at some point. And then another about 6 months on actually doing the divisions with her, like under her supervision. So that was really, really a great course. And I had an amazing opportunity to work within her team for about a year in her clinic. So I learned a lot about that. So yeah, that's how I came to it. And also, obviously, you get to these things through your own children as well. So my youngest son actually has a tongue tie, which should have been divided, but obviously when he was born and he had that tongue tie, as many healthcare professionals, I was of the understanding that he's going to grow out of it, which now I know that that's not happening. That's a myth. And I also didn't know to what extent it can affect the baby, right? I thought, again, as many healthcare professionals, that it affects just the feeding. And yes, I was in a horrible pain at the beginning, but you know what? My body got used to it. He compensated and figured out a way of feeding. So basically we were fine in that sense. But only later on I learned that it's not just about feeding, that it can affect the baby on many other levels. So that's why I looked into it more. And now I help parents and babies who have like feeding issues and stuff. I do not do divisions, although I'm trained to do them. First of all, because I feel that there is plenty of services who can do a division, but there is not enough people or services who would support the baby before and after, especially after, in like retraining the tongue, working on the tongue function, because it's not just about snipping the tongue tie, the frenulum. You have to then go through sometimes quite a lengthy process of optimizing the tongue function, basically teaching the tongue how to move, because tongue tie is something that happens in the first trimester of pregnancy when the tongue develops, right? It's not something that happens after the birth. So the baby already is born with some sort of compensation mechanisms is in them, a lot of tension in the body, because obviously, although it's a very small part of your body in your mouth, it is attached to lots of muscles through your neck and through fascia to pretty much all your body, right? So it does affect their posture, their tension in their muscles and everywhere. So they're already born with this. And then obviously they have like a survival mode. So they need to feed to survive. So they compensate for that for that restriction. So they figure out a way to get the milk from the breast, or a lot of the times parents kind of go on to bottles because it makes it easier. But the fact that you snip the frenulum doesn't mean that all of a sudden they start moving the tongue as they should and they stop compensating. They've learned something and they've been doing it for however long. So they're gonna keep doing it, right? So you need to work with that tongue. Like after every surgery, you need to have a bit of like a physio, let's say, right? If you have something with your leg, you would then go to a physio to retrain the leg to be able to walk fine again, right? So you have to do the same with the tongue. You have to have this kind of physio, relearning how to use the tongue, how to latch on properly, you know, how to suck efficiently and all that. So, and that takes a long time, and not many services provide this guidance and work with parents in this way on kind of longer basis. A lot of not just NHS but also private services would give you like one follow-up, if that, or they just call you. A lot of NHS services just call you a week or 2 weeks after the division to see how you are, but there is not like any ongoing support. So that's what I'm focusing on now, supporting these babies. And I have a lot of babies coming to me, or actually parents saying, oh, he had division when he was few weeks old, but we still have problems. Or I hear a lot of the times it reattached or it regrew, which is another myth. But anyways, it's just a scar tissue that formed, and you just need to work on it. And there is lots you can do. You don't necessarily need to cut that scar tissue again. There is lots you can do to improve the function. So that's what I'm doing. That's where I see myself as useful to people to support this.
It is really interesting, and I must say I didn't know quite a few of those things that you mentioned. So around your talk, I thought it was quite interesting around compensating and how they feed and how they develop, and they manage to, you know, grow in with it and kind of adapt. And you mentioned something, and I wanted to ask you, what are the effects then if this is not kind of addressed when they're newborn? What are the effects on the child growing? Because like you say, quite often it maybe just comes on the back of breastfeeding issues, shall we say, and then that kind of pushes the parent, well, the mum to kind of you know, bottle feed maybe because it's too painful. It feels like the baby's not getting enough, and maybe that diagnosis of a tongue tie is not actually done or is not proper because, as we know, you know, it's not always very, you know, noticeable on examination sometimes. So how does that affect the child growing?
Right. So, well, there are many symptoms that are not necessarily linked to tongue tie, but can be associated with tongue tie. So a part of the feeding issues, and that can be also bottle feeding, right? That's what I'm finding really frustrating in many NHS services, that they would not see for a tongue tie treatment a baby that is bottle fed, or baby who is not at least 50% breastfed, right?
Wow.
But tongue tie affects bottle fed babies same as breastfed babies. It's just that with the bottle, you can always pour that milk into them, right? But they still have the issue. Big one is all these like colic and reflux symptoms. Colic and reflux is not a disease. It's not an illness or diagnosis as such for a baby. It is always a symptom of something else going on, and usually it's a feeding issue, right? So that's another frustrating thing, because if you go to your GP or even your, I don't know, some tongue tie services and things, and you say that your baby has colic or reflux, they'll give you Infacol or something, and tell you to stop dairy in your diet. But a lot of the times parents find out that this doesn't really help. Why? Because the baby has issues somewhere else, right? So that's something that I try to tell parents, if your baby keeps having colic reflux, look into it a little bit more. See lactation consultant or tongue tie specialist, someone who can assess the latch properly, who can assess the tongue function, right? Because if they are swallowing too much air because they're not latching on well, that could be an issue. If they are stressed because their tongue is not functioning and they have issues with feeding, that will impact lots of other things, right? Not just in terms of digestion, that can lead to colic and all that, but also in terms of their whole body, because stress increases tension in the body, and that can then increase issues with feeding, and you're kind of in a vicious circle. So those are big ones. Another thing that I'm seeing quite often is that parents say, he wouldn't do tummy time. He screams in tummy time, or he hates being on their back, or they hate being in a car seat. They scream because they are uncomfortable, because there is some tension, some restriction in their body, which can be linked to tongue tie. It could be something else. It could be simply that the baby had a forceps delivery and something is pulled somewhere in their neck or skull or whatever that creates this. But again, it's something to look into. Another one is sleep issues, right? A lot of these babies would not sleep if you put them down. They just sleep on somebody, contact sleeping, right?
So many.
So many, yeah, contact sleeping and very, very short sleeping. They need to feed like every half an hour, every hour, right? Which can be normal when you have like a 3, 4, 5-day-old baby as the milk is coming in. But if you have a 6-week, 8-week, 3-month-old baby, they should be sleeping some reasonable chunks. They should have, those feeding times and awake times during the day, things like that, but not be feeding every hour for like few minutes or something. Or the other thing is that they feed for hours on end without a break. That is also a sign that there is something going on with feeding, which could be tongue tie, but it could be something else as well. But you need to look into it, because if their suck and if their latch and suction is not efficient, they might not be able to get enough milk from the breast. So they get just enough, and because they're compensating, they're using other structures. They get tired too soon, and they fall asleep without finishing the feed. They might have gotten just enough to fall asleep at that point in time, but in half an hour, they perk up and they're still hungry, so they need to eat again, right? Or they just keep going on the breast because they can't get enough. On mom's side, this can lead to issues with supply, recurrent blocked ducts, recurrent mastitis, all these things, because the baby is not draining the breast properly. A lot of issues actually for these babies come up around the sort of 3 months mark, because initially, although we do still have that demand supply, initially we also have quite high, let's say, hormonal push for the milk supply and the let down and all that. But around the sort of 3 months mark, this kind of switches. Yeah, the switch is obviously gradual, but around the 12 weeks, 3 months mark, it starts becoming a little bit more of a problem if the latch and suction is not good, that the baby starts struggling and mom's supply starts struggling.
So true.
Because at that point, the hormones kind of drop really low, and it really relies on the demand supply. And if the demand is not efficient enough, then you start having problems. So I'm seeing a lot of babies around that time or after that time. So that's that. Obviously, mom, we talked about it. It's the blocked ducts and all those things, milk blisters, the pain, the nipples can be quite sore and
And they quite that's right. And quite often they just say that that's the time, like my milk dried out. I just don't make enough milk anymore.
Exactly.
or the
Yeah,
baby
or I've
doesn't
never been able
settle.
to make enough. Yeah, or
Yeah,
my baby is hungry and they don't settle. So, we reach out for bottles, but that
yeah.
doesn't necessarily solve the problem, right? Obviously, there are women that genuinely have maybe some condition that makes them makes it hard for them to produce enough milk, even
Mm,
if latch is
of course.
fine. But that is quite a small group of women. If we look at the amount of women these days who have this low supply issue and have to resort to bottles, um, most of them, if they had the right support at the beginning, would not need to be in this situation, right? So that's just in the first few months, and then you can have issues once you start introducing solids, because again, if the tongue is not moving properly, moving the solid foods through the mouth to be able to swallow can be quite difficult. Also, tongue tie often goes hand in hand with high palate. So a lot of times the food gets stuck in that high palate
Wow.
and it's difficult for them to process. So you might end up with a child who is labeled as a picky eater, slow eater, all these things can also be down to issues with the tongue mobility. And obviously, because the tongue is not moving, the high palate and all these things can have impact also on the teeth development, crowded teeth. Then you have an older child that needs the palate expansion, all these things. That can also be a result of a tongue tie. And obviously, it can go hand in hand with speech development. And because through fascia, everything in the body is connected from top of our head to our toes on our feet, it can also impact posture. It can impact how the child walks, having feet like pointing inwards rather than that way,
Wow.
flat feet. Later on in life, you could have recurrent migraines, a backache, neck ache, just because of that, right?
That's so interesting.
And obviously the digestion issues because of the impact on
Not
the
chewing
gut.
properly, and yeah.
Exactly. Big thing is open mouth breathing. Mouth
Oh,
breathing is
wow.
a big thing because so normally when you're breathing through your mouth, your tongue would be resting behind your top teeth, sort of against the palate. That's
Yes.
how basically the airways are open and you can breathe through your nose. But if your tongue is restricted and cannot reach the palate, then the tongue sits at the bottom, which then makes it difficult to breathe through your nose, and you breathe through your mouth. And the result of that could be enlarged tonsils, adenoids, all these things, right? So again, a
Wow.
lot of children these days have problems with their tonsils. It may be that the tonsils are not actually the diagnosis on its own. It may be that it's symptom of something else going on. And it's not that you breathe through your mouth because of enlarged tonsils, it's the other way around. So again, if I have lots of parents coming to me with older children because they want homeopathy treatment for enlarged tonsils. I always tell them, yes, I can help with homeopathy to an extent, but you have to look into these other things and work maybe with osteopath, with myofunctional therapist to see how you can fix the mouth breathing. And a lot of the times that can actually help, and you may not need tonsils taken out and all these things. Snoring, already in babies, lots of babies breathe
Yeah.
with open mouth because of that,
Yeah.
and they snore, and it's cute, but actually it's a problem. It's not
Yeah.
cute. We need to start working on it then, because if we leave it, and I did that mistake, my baby was snoring and I thought how cute that is because I didn't know any better, right?
That's
And
well,
now
I'm sitting here thinking it's like maybe both of my kids had tongue tie. Who knows?
uh,
Yeah.
yeah. So
I
yeah,
do
we now
recognize
have
lots
to
of
go.
those.
Yeah, we now have to work on the mouth breathing quite a lot, and it's not as easy when the child is already like 6 years old, right? To redo these things. It is
Yes.
doable, but it's much harder, takes much more time than when the child is few weeks old, right?
Mm-hmm.
And um, also with that, there is a research coming out in recent years that links mouth breathing, the stress levels in the body, because mouth breathing increases the stress levels in the body as well, cortisol and all these things. And it seems that there might be a link with conditions like ADHD as well because of
Wow.
that.
Wow. Really interesting.
So it really is something that we need to look into and think about it a little bit more
Sorry.
than just, we need to look into it beyond breastfeeding basically and bottle feeding, right? And we
Absolutely.
acknowledge that it affects bottle fed babies as well. We can't say, oh, baby's bottle fed, they're putting on weight. That's okay, right?
Yeah.
Because
Yeah.
there can be implications down the line. But yeah, unfortunately, this is something that is not so widely acknowledged as yet.
Mhm.
It's only just becoming more and more, you know, the awareness is just only increasing slowly in the past few years.
Absolutely, yeah. And it's sad also that through NHS you really don't get this level of support at all.
No.
You are saying, you know, best scenarios that it gets diagnosed and it gets snipped, but beyond that is very little knowledge and awareness as
Yeah.
well, in terms of an impact. And do you have any idea around numbers? You know, how often would this generally happen? Because obviously, I'm sure, you know, mums listening to this, they'll possibly lots of them would recognize some of the signs that you talked about, you know, around colics, around not latching properly, around waking up often, you know, not wanting to be put down. How much would you say is maybe due to something such as tongue tie, as opposed to I know obviously we can go into a very deep conversation here around, you know, the impact that childbirth and, you know, going through labor and some of the positioning of the baby in labor would have an impact on that child's development then. But just focusing on the tongue tie, how often does it happen, do you know?
Right. So that's a very tricky question,
It is, I
because
know.
the statistics are very varied, I would say, depending on where you look. Because the problem is that we don't really look at it from the holistic perspective, right?
Mm,
If there is a feeding issue, and the parents go down the line of lactation consultant, tongue tie specialist, oftentimes you get to like a tongue tie person, and whatever they see in the tongue is tongue tie, they snip it, carry
hmm
on, right? Without exploring what else is going on for that baby.
yeah.
So from like, I think Alison Hazelbacher, she's one of the, let's say, main figures in the tongue tie world. She developed one of the most commonly used assessment tool for tongue ties and all that. And according to her, there is only about 3 to 5% of babies who have true tongue tie that needs
Okay.
to be snipped,
Right.
right? Which sounds like a small number if you look at how
1 in
many,
20, not that small.
yeah, but if you look at how many babies actually do get the snip,
Mm-hmm,
right?
mm-hmm, mm-hmm.
So the question is, do all babies that get snip need the snip in the
Yeah.
first place? Or would they just need a bit of body work, bit of like training of the tongue, things like that? Because a massive thing is the whole birth process and everything, right? And in terms of, for example, C-section rates going up quite significantly,
Yeah.
C-section can be a contributing factor for tongue mobility, right? Regardless of tongue tie, these babies might not have tongue tie, but they're still affected. Their tongue function is still affected because when they come through C-section, the vaginal birth has its purpose. It's not just, okay, the baby comes out this way or that way, it doesn't matter. There is a reason why the babies are meant to come out vaginally. And even though it's not very pleasant for us as mothers, and it's probably quite tough for the baby as well to be born, be squeezed out through that narrow tunnel and, being kind of compressed with the contractions. But that kind of massaging of that baby, molding their body through that process of being born is an important mechanism that they're supposed to be going through. It helps to mold their structures, right? Because they are in the womb in kind of still position. They haven't been really, I mean, they are moving, but it's not the same thing, right?
Yeah. Yeah.
So they are supposed to be massaged and molded and, their muscles kind of energized with these contractions being born. But if they're born through C-section, they bypass this, right? And being born by C-section is a very rapid change of situation, right? 1 minute I'm in there, next minute I'm here, like what the hell is going on, right?
Yeah.
So they are often born in a state of shock, like, what just happened?
Yeah.
Right?
True.
And that state of shock can cause lots of tension in their body. Like, it
Yeah.
also increases their stress reactions. The birth through vagina kind of prepares them. It's like a transition. Something is happening, something is changing, right? So it's like a relatively slow transition from one
Yeah,
world to
exactly.
another,
Yeah.
right?
Yeah. Yeah.
And there's lots going on in the baby on the physiological level and anatomical level when they're being born, which they miss when they are born by C-section. So that's one aspect. And that in itself can impact their tongue function, right? And these babies don't need any snip. They just need a bit of craniosacral therapy, osteopathy, physio, massage, something like that to help them release those tensions and readjust their bodies, right?
So interesting. Yeah.
And that in itself can help. But if you have this baby and you bring it to like a tongue tie practitioner, you will see that frenulum in the mouth. The frenulum is part of the mouth anatomy. Yeah, it's not all frenulums are tongue ties, right? But if you come to a tongue tie practitioner who will see the frenulum, and mom has issues with feeding, painful nipples, whatnot, baby maybe not putting on weight or having colic or whatever, they will snip it, right? Without looking around. And again, after they snip it, what then?
Yeah.
Is somebody going to work on the tongue function? Is somebody going to tell the parents how to work on the tongue function? Is somebody going to do some massage on the baby? Are the parents instructed to take the baby to an osteopath or something? That is also a bit of a clash I can notice in NHS service. Lots of private tongue tie practitioners will tell the parents go to an osteopath or something. But there seems to be a big divide between NHS and complementary therapies. It's like them and us, right?
It is also expensive, for some of the parents. I mean, it can be because it's not
it can be,
necessarily.
yes. Yes, I mean,
Yeah.
there are some low-cost services, at least here in London, we have amazing one. But again, not everybody can access it because there is only limited availability,
Of course.
obviously. You have to travel, and it would be great if that was something offered on NHS, but we probably would need to wait for it for a few years. But NHS has physios, so maybe the physios can help in some way. Yeah, I don't know much about physios, if they're trained in working with babies or, in this way. But it is a missing piece in the puzzle, basically.
It really is, yeah.
Because, if you don't have that physio after the surgery, it's not gonna heal in the right way. The tongue function is not gonna improve, and the whole thing is not gonna change, right? So back to the numbers, it's really difficult to say how many babies really have tongue tie that needs to be divided, and how many babies actually don't need any division and it was unnecessary treatment. right?
Absolutely.
So
It's so interesting, so interesting. So I suppose from your point of view, I get asked this a lot from some of the mums who have had a baby in the last few weeks. What would you say to someone who would say, "Oh, I think my baby has colics because they're just crying all the time and I don't know how to console them." That I mean, I know it's a normal, in a way, it's a normal part, isn't it? Quite often, lots of babies would do this, but how can you actually support them, and what would you say?
yeah, I mean, yes, reflux especially can be normal in some babies, right? Because they're born with still not quite developed gut, and it needs some time to keep developing, get stronger, and all that. So a lot of babies can have a bit of reflux as like a normal part of their development. But if it's like projectile vomiting or vomiting a lot after every feed, and baby's uncomfortable and have visibly uncomfortable tummies, and they scream for hours on end and all that, you need to look into it. Like giving the baby Infacol or gripe water is not gonna help. It might bring a bit of a relief at that point in time, but it doesn't solve the issue long term. You would have to keep giving it again and again and again, and there is only so much you can give, right? So I always tell parents, ideally start looking into breastfeeding and all that before the baby is born. Get lots of information, just also that you know what to expect, how breastfeeding actually works, right? How it works with the supply, so that the mom is not in panic, I don't have enough for my baby. Just that they understand that in the first few days it's pretty normal for the baby to feed very frequently, right?
Yeah, true.
And all those things. Also looking into sleep, that's a big thing. Like, unfortunately, many parents don't have realistic expectations in terms of baby sleep, right? So looking into that, there are many great books on sleep. I really loved the book published by La Leche League. It's called Sweet Sleep. It explains the development of baby sleep and what to expect at different ages, right?
Wow.
And just that parents understand what's coming.
Yeah.
And also part of that preparation should be mapping around your local breastfeeding support. What NHS support is there? Are there any free groups, or any NHS community support for breastfeeding, or private support around you, just to map it, just to have an idea if you do need help, where you find it. Because once you are in that position that you do need help, it's really stressful and difficult to start looking around for support. Look into colostrum harvesting, expressing colostrum before birth. I think that's a really, really great practice. First of all, the woman learns how to hand express, which can be really useful, when your milk comes in the first time you're engorged, and you need to hand express a little bit to make it easier for the baby to latch on. Again, if you are in a stressful situation, it's really difficult to search videos and learn how to do it. If you've already done it, it's much
It
easier.
just comes back, yeah.
Plus, seeing that colostrum before the baby comes will put your mind at ease. You will know it's there. It's there. I have it. You also have the syringes extra if you need a backup. So again, it kind of takes the pressure off you when the baby comes. You're a bit more relaxed in knowing that you do have the colostrum, and it's just about working with the baby and allowing them to do what they need to do. And then also kind of build your village, right? They say it takes a village to raise a child, right?
Yeah.
That's very true. So kind of as you write your birth plan, also write your postnatal plan, taking into consideration like who's gonna do the shopping, who's gonna do school runs if you have other kids, who's gonna be doing the laundry and tidying up the house, who's gonna be doing the cooking, what you're gonna eat, right? And I know lots of women tell me, oh, I have my partner, he's very supportive and all that. Yes, that's great, but it's only the two of you. And inevitably, both of you will get tired at some point, right? Especially if you have that baby who contact naps and needs to be carried all the time and all that. You know, you need some extra hands as well. Or if the birth is long and the partner is with you in the hospital and doesn't get sleep for 2 nights or something, you're going to be both exhausted. So you need extra support. Any relatives, any friends who could come and bring you a meal, or can come and put your laundry into a washing machine, or get you some groceries, you know, or take your child to school and back, right?
Yeah.
Or even if you can afford it, get someone who will come and clean your house once a week, you know. Any help that you can get, it's really good. Just write it down. Just check with your friends and relatives who can do what. If you don't need it, I'm sure they're not going to be upset that you don't need them, right? They will come with a cake and make a cup of coffee and you will chat. But if you do need the extra help, it's good to have it already planned rather than trying to call everybody and see who can come and help, right? So I think that's a really important thing. And part of that village should be also that lactation consultant who can support you, or a doula. You know, there are lots of amazing doulas who can help with breastfeeding and do lots of different massages and other stuff for moms and babies. So, you know, have this in place. That would be my biggest advice for every parent to be: sort out your postnatal support network.
I really like that. I'm gonna teach that as well. I'm gonna pinch it with pride. It's such a good point. I've never heard of, such thing as a postnatal plan, but it's such a great concept.
Yeah, and
I
especially
really like
for
it.
us who are like immigrants to this country, right?
Mm,
We might not have any family around. Like for us, it's only me and my husband. My
yeah.
family is in Czech Republic. My husband's family is in Algeria. So we don't really have that support network, a part of our friends, right? So, and I
That's
know
right.
that there's lots of families like that who don't have the grandparents around and aunties and uncles. So more so, it's important to look out and reach out to your friendship network. If you reach out to people, they will help. People usually want to help. It's just that they don't know how or what would help you, right? So
Yeah.
instead of them coming to see you and the baby with a piece of cake and then just sitting there and smiling and chatting, you know, give them something useful to do. Not that the
Yeah.
cake is not nice, but you know, you also need to eat a proper meal.
Yeah.
You need to have your fridge kind of stocked reasonably.
Yeah.
You need to wash your clothes, stuff, or
Yeah.
baby's clothes rather. Maybe not yours so much, but baby will go through a lot of clothes, right? So yeah, thinking
True.
about these things and planning it in advance can be really life-saving.
Yeah, absolutely. Absolutely. Yeah, it's such a good point. So I wanted to ask you a little bit more about your homeopath like journey. First of all, just wanted to ask you, how long did it take? I know you mentioned it at the start, but how long is the course in itself?
Right. So the courses are usually 2 to 4 years. It depends. So
Wow.
if you do like it's usually called something like fast track course, which is very intense. They condense the 4 years into 2 years. You can do that. I've done the 4 year course because with family, with 4 kids and
Of course.
full-time job and all that, I just couldn't.
Yeah.
Even that was really, really challenging. And I had times where I thought, no, I'm gonna quit. I can't do this. It's just too much. It's very intensive training because you have to do all the lectures. There is lots of like homework and written assignments you have to do, because most of the courses, if you want to be a licensed practitioner, a homeopath, are pretty much on like a degree level. It's just that and it used to be taught at a degree level. It's just a few years ago, somebody decided that we don't need degree in homeopathy. So it was kind of taken off the degree pathways, but the level of what you need to do is still the same, right?
Yeah.
So
Which is
there's
a
lots
shame,
of
really, because it
it
almost
is
makes it sound as it's not
you pay
worthwhile.
pretty much the same amount of money anyway,
Yeah.
right?
But it's through the eyes of the public, you know what I mean? Because when
Yeah,
you say I do have a degree in this is one thing to the normal year, do you know what I mean? Someone who doesn't understand it.
yeah,
Whilst if we say I've just done this course, they might be thinking is not as relevant as it is.
yeah, absolutely, absolutely. So yeah, you also have to do lots of supervision sessions where
Mm-hmm.
you bring your own cases and discuss them with your supervisor. Like, they guide you whether you are um, kind of prescribing in the right way, or
Oh, okay.
what would be a better way, things like that. We had a lots of clinics that we had to attend. That's like compulsory. It counts into your hours. And you can't graduate if you don't have all these hours in. The clinics were mostly online. So again, it's different courses. Some courses you can do in person, some courses you can do online. Again, I chose the online option just because, with a midwifery job,
Yeah.
it's kind of hard to schedule
Yeah, I bet.
sometimes. And especially if you do something like home birth, kind of difficult to predict sometimes.
Yeah.
Um, so the clinics were also online. So at certain time you have to be online and you see the patient online. And again, it's you and the patient and the tutor or supervisor. So yeah, it was quite full on, a lot of stuff to
Sounds
go
like it.
through, and but it was very interesting, very fascinating. Yeah, and I'm glad I've done it.
Oh,
I'm
I'm
glad I
sure
didn't
it's
quit.
of course, I don't think anyone is really regretting the work done, isn't it? Is maybe at
Yeah,
that time, at that moment in time, you think, oh, this is so hard. But once you've achieved it, quite often the hardest it is, the more you actually acknowledge it and feel proud about
yeah,
it,
yeah,
isn't
yeah,
it?
yeah.
So I wanted to ask you then, from this point of view, because obviously we're aware of the traditional medicine, shall I say, but some of the things that maybe you have suggestions from a homeopath point of view in pregnancy, and I was just wondering, in regards to maybe back pain, things like that, what would you normally advise in terms of, pain in pregnancy, which we know happens? Such as
Right.
back pain, sciatica, SPD, that kind of
Yeah,
thing.
yeah. So for all these pains, back pain, sciatica, SPD, all these like musculoskeletal
Mm.
pains and aches, I would always suggest that the woman sees osteopath or physio.
Hmm.
Now again, we're getting to the issue with NHS that yes, your midwife or your doctor might be able to refer you to physio, but we all know about the waiting times, right? And by the time you get the appointment, you're about to give birth, right?
For your baby six
So
months old.
yeah, so sometimes we still do need to look into the private sector, and I know it can be pricey, but if you can afford it, I would definitely suggest to look into these options. I had quite bad SPD in my last pregnancy, and I did go to see osteopath. I did go quite early, from around maybe like 20 weeks.
Wow.
Well, it was my fourth, and I was around 40, so
Yeah.
the body kind of
Yeah.
takes the toll, and it progressively
Yeah.
is harder and harder on the body. So yeah, I did go to see an osteopath, and I was seeing her quite regularly, and that kind of made all the difference. I was able to move pretty much normally without much pain until the end of my pregnancy.
Wow.
So I really do recommend that women consider this option. What is also important is regular movement, right? Go for a walk every day. Walking is one of the best exercises for pregnant women, and it can help with lots of aches and pains. Or swimming. Swimming is amazing. So if the woman likes swimming, go swimming, right? Because that, first of all, especially in the later stages of pregnancy, the water buoyancy kind of takes off that heaviness.
Yeah.
A lot of
Yeah.
it. You feel much lighter. It's much easier to move. And it's really great exercise for all the muscles, for the whole body. So it can really help with all these pains and aches. So yeah, exercise, other great exercises, pregnancy yoga or Pilates, really, really good, right? And that can be cheaper than seeing an osteopath.
Yeah.
Right? I mean, you can find lots of videos on YouTube as well, which is free. But sometimes it's really good to have that teacher in the class. Also, you know, for that little bit of community of other pregnant women, things like that. So, you know, again, looking at all your options. So that might be really good. And then, you know, the good old hot water bottle on your lower back, things like that can really help, you know, that heat. Even get your partner to massage you if you know, if needed. It's also important to look into your sleeping, right? We get lots of these aches and pains because we don't sleep well. So do you have a good mattress, or did you have this mattress for donkey's years and it needs changing, right? Get different cushions, or that like pregnancy pillow, you know, the long one to kind of support you so that you're in bit more comfortable position. That can make a lot of a difference as well. And then in terms of homeopathy, it really is great to work with a homeopath, because in homeopathy there is no one size fits all, right? I could have 10 women coming to me with headache in pregnancy, for example, but each of them will end up with a different remedy, because each of them perceives it different. Each of them has a different quality of headache. One might have a headache in the front, another one in the back of her head. It might be spreading to her shoulders. Another one might have vomiting with it, or other things going on. So it's very individualized, and it's always about the whole picture. What else is going on with that person, right? So same for the back pains and sciatica and all that. I would say, first of all, the body work, some sort of body work massages, pregnancy massage, is really important, because it's like a mechanical issue, right? So we can help with homeopathy to an extent, but we also need the other part, you know, the biomechanical kind of input. But if one of the main ones may be for stiff muscles, pains and aches, things like that, is a remedy that is called thrust box, for example. And that's a good remedy if your aches and pains get better when you put that hot water bottle on it, or some sort of heat, or when the pains are better when you're moving, right? Sometimes we have aches and pains, and when we start moving, it gets better. Then Rastox is one of the remedies that could help, and it's especially good for the lower back pain. Another good one for lots of complaints in pregnancy is a remedy called pulsatilla, which is especially if the woman feels a little bit emotional, a little bit weepy, a little bit tender, you know, that kind of emotional feeling behind it. And she needs the hug to feel better and all those things.
Comfort.
In terms of homeopathy, if you're not sure and you need a quick advice, I would recommend a website. It's called Swift Homeopathy Clinic, where you can book like an acute or urgent consultation. It's maintained by homeopath 24/7. So there is always a homeopath on the line. It's not a bot, it's a live person.
Oh, wow.
I'm actually one of the homeopaths on Swift. So we run the line 24/7. We like have shifts for our shifts. So there is always somebody to talk to you. It's not a free service. You get a 20-minute consultation for £42, and the homeopath will take your case history, what is going on with you, and then send you an email with what remedies you should take and where to get the remedies. It's helpful if you already have some remedies at home, but it's not difficult to get remedies in UK pretty quickly. And then the same homeopath will like send you follow-up email, catch up with you, how you're doing in 24 hours and 48 hours, just to see whether
that's
the
good.
remedies are helping or not. And also if you have this like acute situation, like aches and pains, coughs, flu, fever, whatever, it might change, right? So we might give you one remedy today and some of the symptoms get better, but some of them might still stay, or they might change a little bit, you know, because like flu, it changes, right?
Yeah,
Day by day.
yeah.
So you might need a different remedy the next day. So that's why we do this like support for another 48 hours to see whether you're doing okay with the one remedy or whether you need something else, change it, things like that. So that's a good
Wow.
resource as well.
Absolutely, yeah. I didn't know of this. Really interesting.
But also if it's something like ongoing, a long-term issue, or if the woman wants to support throughout the whole pregnancy, then she would need to like work with a homeopath on like one-to-one basis,
Yeah.
a little bit more consistently.
Yeah. Wow, really interesting. Thank you. So, then I was wondering, just again, quite some common issues in pregnancy, for example, heartburn. What would you normally advise aside from, Gaviscon? Take some.
Sorry,
Sorry.
I lost you for a bit. What was the question?
Sorry, yeah, it's probably me. I was just wondering, in regards to things like heartburn in pregnancy, which lots of women suffer from, what would you normally advise aside from, the Gaviscon or the normal medication that they will tell you to take?
Right. Well, it kind of depends when in pregnancy it is. If it's like the early pregnancy, then yes, the Gaviscons and stuff might help because it might be the acid issue. But
Mm-hmm.
if it's like later on in pregnancy, then antacids like that might not do much of a difference because then it becomes more mechanical than acid issue because, you know,
Yeah,
as the baby and uterus grows, it kind of pushes against the stomach, making it smaller. So, and that causes the heartburn, the acid reflux, right?
yeah,
So at that point in time, it's better to eat little so that you don't overfill your stomach, but maybe a bit more regularly, maybe every 3 hours or something, have something small that might kind of help reduce the sensations as well.
mm-hmm.
And then, you know, all the usual stuff, like, again, it kind of depends. For everybody work different things, but it could be ginger. Some women really like ginger cookies or ginger, like sucking on ginger or having like a ginger tea, for example. For other women, milk works, drinking
True,
a glass of milk or something. For other women, and what worked for me in pregnancy was having a warm water with lemon juice in it.
okay.
Although lemon is acidic, apparently it kind of sort of neutralizes the stomach acid or
pH, yeah.
something, alkalizes it. So yeah, that worked for me. So that's something to try as well. And also it's about kind of trying to notice whether there is something in what you're eating that is making it worse, and then maybe avoiding that. For some women, it could be spices. For some women, it could be sugar. For some women, it could be bread, you know, making it worse. So yeah, looking into the kind of food link as well.
Yeah,
And
absolutely.
then when you're sleeping at night, trying to be propped up a little bit, not completely flat, just that, you know, the everything stays down and not coming back up again.
Yeah.
And in terms of like herbs, what women could try, one of the best herbal teas for pregnancy is chamomile. It's very calming and it's very good for all sorts of stomach and gut issues. So that might be something to try. It's also nice to drink it in the evening. It can help a little bit with sleep because it's generally calming, not just calming for the gut, but overall.
Yeah.
And then again, if the woman would like to try some homeopathy, one of the like main remedies for heartburn is a remedy called Nux vomica. And that is especially if the woman feels like a sour belching sensation together with the heartburn. It's also a good remedy if you have like stomach issues, if you've eaten too much, for example, or if you've eaten something bad, like food poisoning, stuff like that.
I
So that's
see.
a really
Wow.
good remedy for that as well.
Oh, good. Nice. Again, something I didn't know for sure. And what about hemorrhoids? Again,
Oh yeah,
quite a
that's a
common
big one.
problem. Sorry.
Yeah, that's a big one.
It
Yeah,
ties in obviously quite
it
well
does.
with
It does. And
lots of
it
other
also
things.
ties in what we said at the beginning about the lifestyle and all
Yeah,
that, right?
yeah, yeah,
Because
yeah.
biggest risk factors for hemorrhoids is like a sedentary lifestyle, being overweight, not having a good diet, having recurrent constipation and all that. So step number one, fix your diet. Look into whether you have enough fluids, enough fiber, whether you have probiotic foods like yogurt, I mean plain white yogurt or kefir, all these things.
Yeah.
And then in pregnancy, especially, it's important to kind of stretch your legs here and there, because as we have the heavy uterus and all that, it could be restricting the blood flow to the legs and back, or like the lower part of your body, and that can be actually contributing to having hemorrhoids, varicose veins, and all these things. So not wearing like restrictive clothes, having like looser clothes so that you don't restrict the blood flow even more, walking around a little bit to stretch your legs, enhance the circulation, maybe something like, the pregnancy support belts to lift off the weight of the uterus a little bit. Pelvic floor exercise is really important as well, so that you strengthen the whole pelvic floor so that the hemorrhoids are not popping out and all that. And also it encourages the circulation, so it helps that way as well. And then if it already happened that you happen to have hemorrhoids, then you can actually get a nice homeopathic cream for hemorrhoids. So there is one of the homeopathic pharmacies in UK is called Helios, and they do cream made from hamamelis, esculus. Esculus is horse chestnut, and that's a very known like herb for hemorrhoids anyway. So you can even get esculus as like a tea or something.
Okay.
So esculus, hamamelis, and peony is the third one. So you can buy like a homeopathic cream for hemorrhoids as well. Another nice thing to do for hemorrhoids is a sitz bath. So basically you take like a vessel
Yeah.
where
Yeah.
you can sit in, put some warm water, and you can put either like Epsom salt in there or witch hazel. Witch hazel is really good for hemorrhoids, and just sit in it for a while or until it cools down, or as long as you feel comfortable in there. It can help
Yeah, with the
soothe
discomfort. Yeah.
itching and the
Yeah.
discomfort and stuff
Yeah.
like that. Yeah.
Really,
But no,
really interesting. Right. I have another question. I'm so sorry, but I'm
that's
going
all
to.
right.
I was just wondering, what is your view on probiotics, both for pregnant women as well as babies?
Right. So any supplements and stuff, I recommend that women get everything from food in the first place and use supplements only if they need them.
Yeah.
So same with probiotics. There's plenty of probiotic foods you can get, right? So plain white yogurt you can buy in any shop, right?
Yeah.
Kefir. You can buy kefir in supermarkets as well, Polish shops, all Eastern
Oh,
European
yeah.
shops,
Yeah, yeah, yeah. Yeah.
right? That's our thing, right?
Yeah, 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 absolutely.
Things like fermented vegetables, sauerkraut, amazing probiotic. So yeah, it's very easy to buy these things and incorporate in your diet, which many women already have anyway. But it's also about, on the other hand, eating in a way that you don't compromise your microbiome. So having generally healthy, balanced diet, trying to avoid processed foods and junk foods and lots of sugar and all these things. And then obviously sometimes we need to go on antibiotics, or baby needs to be on antibiotics, things like that. So then it might be a good idea to look into getting probiotics as well, on top of having probiotics in your diet. Generally, it's recommended if you are on antibiotics to take the probiotics while you are on it and then at least 2 to 4 weeks afterwards to help your gut rebalance again.
Yeah.
You can get probiotics for babies as well, even if they're breastfed or bottle fed. You can put it in the milk, or it comes in a powder form, so you can put it in their mouth, or you can put it on your nipple and they can lick it that way. Obviously, for babies, breast milk is the biggest probiotic out there, right? So if you're breastfeeding, that's amazing. You're already giving the baby the best you can. If you feel that they need extra, first of all, you put probiotics in your diet as well, because obviously your gut microbiome affects the baby, not just through birth and skin to skin, but also through the breast milk. So it's still important to work on it as well. And if you feel that it's not enough, then do get probiotic for the baby as well. Bit different situation is with babies on formula, because formula obviously doesn't contain pretty much anything alive. So I would suggest that if baby is on formula, it might be a reasonable idea to get them some probiotics on a regular basis, basically.
Yeah. And how is there any way that are all probiotics the same? Are there some that are better than others, and how would people
Right.
recognize those?
So there are different brands out there. I don't know if you are allowed to mention any brands in
Well,
this
it's
video.
fine. You can. That's absolutely fine. You can mention. But
the most common brands that I tend to recommend, or that people tend to get, is Optibac or Biokult, and there is also a good one by BioGaia. They also do vitamin D with probiotics for babies. It comes in drops, so babies are supposed to be getting vitamin D anyway.
Yeah.
Especially if they're not on formula, because formula is already fortified.
Yeah.
They need to be at least on half a liter of formula a day. So if you're meant to be giving vitamin D anyway, and you need to give probiotics as well, then this is a good
He already has
option.
it in.
And they do have a specific probiotic product for babies, right? So it doesn't matter which brand you choose, it should be for babies.
Yeah, yeah. Oh, that's easy enough. Yeah.
Yeah.
Thank you.
Yeah.
Right. Last question. I was just wondering, but it's a bit complex, sorry. I was just wondering
Which questions wasn't complex today?
I know, I'm so sorry. But it's been really interesting. I was just wondering, from your point of view, what would help going through labor and birth in an easier way? What can someone do throughout pregnancy? Maybe, for example, teas or things that they can eat to kind of support the uterus in working a bit more efficiently, and also essentially just helping mum to get through labor a bit easier.
Right. So yeah, it starts from beginning of pregnancy with nutrition, right?
Yeah.
Your body needs to be well nourished to work properly in labor, right? So good nutrition throughout pregnancy, hydration, exercise, so that your body is healthy and fit. And then another good tea for pregnancy, we already talked about the chamomile tea. Another good one for pregnancy is a nettle tea, stinging nettles, those that you touch and it gives you rash.
Yeah.
It's a really good herbal tea that supports your liver and your kidneys. It is a mild diuretic, so it can make you pee a little bit more than you already are, but in pregnancy you pee a lot anyways. So it won't be that much of a difference.
Yeah.
And it also is very nutritive. It can support your iron levels and all sorts of these little things. So it's quite good to drink that throughout pregnancy. And then towards the end, in like third trimester, maybe from somewhere around 30 to 34 weeks, you can start drinking raspberry leaf tea. That's a very well-known one. A myth is that it induces labor. It doesn't induce labor. It is a uterine tonic, so it helps uterus work more efficiently, and it also supports iron levels. So it's a quite nice one at the end of pregnancy, and you can combine them. You can mix your nettle and raspberry leaf together. It's perfectly fine. It's good to build up, to start with 1 cup a day and build to 2 cups and then 3 cups in the last few weeks. So that's a good one as well. And then part of the preparation for birth, I do recommend, again, seeing the osteopath just to check, your body, your pelvis, if there are any misalignments and all that, just to allow the baby to slip into the right position, things like that, that can really help. And also women can look into the spinning babies. That's website, spinning babies. And basically it's like a exercise program to, again, encourage the baby into an optimal position for birth. It can help turn baby from back to back to the front position. It can help babies turn from breech to head down position as well. So they have lots of little different exercises. So it's something to explore as well in the third trimester. It might be a good idea to consider some antenatal class, looking into hypnobirthing, all these things. Mindset is a big thing for birth, right?
Yeah.
If you have any fears, any worries, any anxieties around birth, try to work on it beforehand, right? Because these things can kind of impact the birth process. Because if you're scared, if you have any anxiety, it can kind of prevent your body even to go into labor.
Yeah.
Right? The mind-body connection is massive. And we know from the animal world that if the mother mammal is not feeling safe, if she feels there are some predators around, her labor will stop right in the middle of it until she feels safe again.
True.
And in this respect, we are not different to these, our primal instincts are very same to to other mammals, really. So that's a really important thing to work through. And more so if you've had the baby before and you had some traumatic experience, it's really important to work through it before you have your next baby.
Absolutely. It influences us so much, isn't it?
It does. If you can afford it, it's a really good idea to consider having a doula who can support you through birth, before and after as well. I know that most women would have their birth partner, but the doula is kind of like an additional support for both of them, and it can really be really helpful to have someone else, it's like the third, like the second opinion, if you like, or like in midwifery we have this fresh eye kind of thing, right? So similar to that, because doula is someone outside of your bubble. Obviously they do get that relationship with you, you have the relationship with them, but it's still different. They can have that like overview of the situation, and if you're in labor and things get a little bit emotional or stressful or whatever, the doula can still have that like more rational view, or not having that, let's say, bit of a distance from it, to be able to support you, give you a guidance, and calm the whole situation down. Doulas have lots of information, lots of resources, so they can help you research different issues that might be arising, questions around inductions and all sorts of other stuff. So that might be a useful resource, useful support to have. And then Another thing to consider might be acupuncture. Again, acupuncture can help your body get ready for birth. Not that it induces labor again, although there might be some points that can like help kickstart it, but they can also work with you on a little bit more regular basis, help your body kind of get to where it needs to be.
Interesting. Tell me, how can people who have listened and maybe they want to work with you, they want to get in touch with you, what would be the best way to reach out?
Right. So either I have a website, so people can go on my website to see what I do. It's very simple, www.barbarahanashova.com. And with the same name, they will find me on Instagram and can follow me on Instagram as well.
Excellent. And do you only work face-to-face in London, or do you provide anything online, any advice? You mentioned the homeopathy website.
Yeah. So I do face-to-face mostly for the like midwifery stuff, the antenatal, postnatal care, the infant feeding, because you do need to physically work with that person. Although I do have like a midwife coaching program online where I work with the women throughout the pregnancy. We just meet online so they can live anywhere really. And it's more about getting that additional support, talking through everything that's coming up through pregnancy, diet through pregnancy, exercise, any aches and pains. And if they need any homeopathic remedies, I send them the remedies if they live in UK, or tell them what remedies to get and where, suggesting herbs, all these things. So that's a midwifery online option. And then for homeopathy, I do that mostly online. If people want really to see me face to face, that is a possibility. I have like a little clinic space in one local yoga studio that I can use. Which is sometimes useful if I'm treating babies with eczema, for example. Sometimes it's useful to see the skin live rather than on pictures. I mean, I do treat lots of babies with eczema online and parents send me pictures, which is very helpful as well, but sometimes seeing it live is even better.
Brilliant.
I have both options.
No, that's excellent. That's really good. Thank you so much. Thank you. I could talk to you for the rest of the day, but I'm sure that I'm sure there'll be lots of other things to do. Thank you. I really appreciate this. So yeah, I'm sure lots of the listeners will find this useful. So thank you so much again for your time. It was a real pleasure today.
That's all right. It was a real pleasure, and thank you for having me. It was really nice talking to you, and I hope that it will be useful to your listeners. And yeah, if they want to get in touch, get in touch. I'll be happy to help if I can.
Thank you. Thank you. Thank you so much.